Good morning. We're here today at the North County Recreation Complex, where St. Louis County has opened another COVID-19 testing location to increase its testing capacity in our Department of Public Health by 50%. In St. Louis County and across the country, we've seen a record number of COVID cases as they continue to increase. And unfortunately, the number of hospitalizations associated with those cases is increasing as well. And it's alarming for many reasons. We're seeing more young people hospitalized, even those who are unable to get vaccinated because of their age. We're seeing our hospitals again stressed because of the number of sick people that they are taking care of, but also because of the loss of staff that are burned out, or staff that are themselves sick with COVID and can't come to work. And we're seeing more deaths from the virus. More than 1,200 people with COVID are hospitalized in our health systems, the 4 health systems that make up the pandemic task force. And that record, unfortunately, will be broken again and again in the coming weeks. And one key to controlling this virus is to get tested. And it helps to know whether or not you're positive before you think about going to the office or going to a classroom. Whether or not you need to isolate, to monitor your symptoms, and to stay away from others to avoid spreading the virus. The Department of Public Health in St. Louis County, which began testing early during the pandemic, now provides 2,000 tests per week at its 3 locations in Berkeley, Pine Lawn, and Sunset Hills. And this morning in this parking lot, we're able to add another 1,000 tests per week, expanding testing here in North County and amongst our most vulnerable population. This represents a 50% increase in the capacity of testing in our public health department, and we hope to increase this from 200 tests per day to 300, and then later to 350 tests per day at this location. And we opened the testing site here in this part of North County because this is one of the places that's been hit the hardest with the number of cases, the severity of illness, and unfortunately, the number of deaths. And St. Louis County continues its aggressive outreach in targeted zip codes to try and address gaps in vaccinations and to get more people tested. Responding to COVID has been the biggest challenge in our country over the past 2 years. And I really want to recognize our health departments all over the country for their dedication. We've seen public health leaders across the nation threatened and harassed, and some of them have even left their posts to find another line of work because of the intense pressure that they're under. But they worked very hard, made some tough decisions to provide us the guidance, the protocols, the public health orders that we need to keep our residents safe and their families safe as well. Public health guidelines put into place to protect everyone, unfortunately, has become political fodder, not only here in our region, but in communities across the country. And that's a shame. Last week, the St. Louis County Council approved the St. Louis County Public Health Order proposed by Dr. Khan, which will help slow the spread of the virus in our community, the highly transmissible Omicron variant. The move was long past due, but it was greatly appreciated in our community. This testing site here in North County will be open Monday through Friday, 8 a.m. to 4 p.m. Because the demand is so high, in order to avoid long lines, we're asking everyone to make an appointment at our website, revivestl.com. Please do not come here to get a test without an appointment. The test will be administered in your vehicle while you wait in line in the parking lot. Unlike other testing facilities in the community that use a nasal swab for the test, here at this location, we'll be able to provide tests with a saliva test. And that's the form of testing that we'll use here. We urge anyone with symptoms of COVID-19, as well as those who've been exposed to COVID-19, to isolate and then get a test as soon as possible. I'd also like to take this opportunity to remind everyone that the booster shots are now available for those aged 12 to 15. Last week, the CDC recommended that in their new guidelines for this age group, and those booster shots are now available at our 3 St. Louis County public health locations, Pine Lawn, Berkeley, and Sunset Hills. For vaccines and boosters, you can walk into one of our health departments and you don't need an appointment. Appointments are available if you want one, and you can make those at revivestl.com. Now, the Pandemic Task Force has warned us over the weekend that hospitalizations could double in the coming weeks. And that would result in COVID competing with other medical problems, competing for the attention of our healthcare workers and for people that need help. Those that have been involved in motor vehicle accidents or are suffering from a stroke or a heart attack. Now, we can avoid that by getting vaccinated, getting a booster, wearing masks, following our social distancing guidelines whenever possible, and washing our hands as frequently as possible. And for many folks, this sounds like a broken record, but it bears repeating over and over again. Slipping into complacency helps no one. Denial can be deadly. So yes, you'll be hearing from me about this. You'll be hearing from other doctors in the community, other medical professionals across the region. But if you don't want to listen to me, listen to your family doctor. Listen to those who've had a family member or a loved one who've been affected by COVID-19, who've been seriously ill or been hospitalized. And listen to those who are doing everything they can to keep our kids in a classroom this semester. Thank you, and I'd be glad to answer any questions.
Dr. Page, can you speak to the importance of opening up additional testing sites like this one? Why is this so important in your mind to have additional sites available to people to get tested?
Well, the question is, why is this testing site so important? Since the beginning of the pandemic, St. Louis County has worked very hard to address the needs of our more vulnerable populations. That's the role of the Public Health Department, to provide guidelines and guidance for the community, but also to try and provide healthcare services to uninsured and underinsured. This part of North County has been most affected by the pandemic. The cases have been highest. This part of the community has been hit the hardest, and unfortunately, we've seen too many deaths in this region of North County. We know COVID's affected everyone, and not everyone in our community has access to health care, and the role of the Public Health Department is to try and step in and fill that role.
Dr. Page, we know that these are PCR tests at these testing sites. Is there any plan for the county to help people get rapid tests either at home or at these sites?
Yeah, the home rapid tests will be provided. Well, you certainly purchase those through a pharmacy. We hope that the federal government's plan to make those available through the mail in January will come to fruition. As soon as we know more about the federal distribution of those home testing kits, we'll certainly make that information available, and if the county health department has a role in that distribution, we'll do that as well. Right now, the county's focused on providing the tests that we have access to. We have access to the PCR test. We have access to some saliva tests. As we're able to purchase more, we'll get them out in the community. The access to testing is in part due to the number of tests that are available, but even more so the number of staff that we have to provide those tests. The volume, as you can imagine, of people who need tests has skyrocketed. The county health department has a role in that testing, along with everybody else in the community, pharmacies and health systems.
Do you foresee any delays in people getting the results on those testing?
Well, so far we're able to, everyone that's in the testing space, our public health department, our retail pharmacies, our health systems, the home testing kits, we're able to get results pretty quickly, some immediately and some within 24 to 48 hours. We haven't seen anything like the delays we saw when testing first became available, some of those lasting days. some people not getting the test results back until they've recovered from their illness. But we haven't seen anything like that yet. But you know, we're going into unprecedented times. I don't know that we can completely imagine or comprehend what we haven't seen yet, and that's a volume of COVID, a caseload of COVID in our community that we haven't experienced.
With that in mind, pediatric cases are soaring like never before, and we're dealing with Omicron and Delta at the same time. Do you foresee schools going back to virtual like they've done in other places?
So the question is, with rising caseload, what should we expect from schools? And every school is finding their own path. Some are requiring masks and doing everything possible to keep kids in the classroom. Some schools are going to virtual. We're hopeful that we can keep as many people in the classroom as possible. We do believe that if we can find enough tests in our country to distribute in our community, that we can help with our quick turnaround on testing. We're hoping that widespread adoption of masks in our schools will help keep kids in the classroom. But we will see what this caseload does. It may force more schools to virtual.
Dr. Page, the pandemic task force this morning put out a release urging people to go to alternative testing sites and not hospitals for testing. Could you speak to that a little bit and the importance of people utilizing sites like this one rather than going to ER?
Yeah. Well, yes. So the question is about the pandemic task force communication to ask folks who are not sick to not come to the emergency rooms looking for a test. And that's important for everyone to think about. If you're not sick enough to be in the hospital, if you're not having breathing problems, if you're not experiencing an illness that's life-threatening, it's important not to go to the emergency rooms. They are overwhelmed with really sick people right now, and they're having trouble processing them with a limited number of staff, and we don't expect that to get any better. It's really important that folks that are not sick find another way to get tested or just stay home. We hope that through our pharmacies, through other testing opportunities in our community, we'll certainly do what we can with the public health department. We can't provide the healthcare infrastructure for the entire community. Our focus is primarily on uninsured and underinsured, but we will do everything we can to pick up the slack in our community in this unprecedented time where we can't completely comprehend the volume of COVID that's coming to our community.
Are you aware, Dr. Page, about this testing site at the Machinist Home in Richmond that was canceled on Saturday at the last minute? Do you have any information about that? There were apparently some concern about why that happened.
Yeah, so there was a testing site at the Machinist Hall over the weekend that was canceled. That was a testing site sponsored by the State Department of Health and Senior Services, along with some of the labor organizations here in town. I don't know if that was a test supply issue or a staff issue. I don't know the details, but I did hear that it was canceled on Saturday.
So do you need volunteers? I know when we first started vaccinating, that was something we were asking for. Is that something that's needed now as well?
You know, our health department is not yet looking for volunteers. Early on in the pandemic, we asked folks with healthcare experience and training to come forward and volunteer. It appears at this point in time that most of those folks are deployed somewhere in the community currently working with the health systems or somewhere else. But I will circle back to our health department and see what their capacity and need is for volunteers. That's a good question.
Earlier on in this pandemic, you guys took over a hotel here off of Dunn Road. Is there any more options to do that?
Yeah, so the question is about capacity for health systems and what their plans are moving forward to take care of the expected onslaught of patients and whether or not they will be looking for healthcare facilities, non-traditional locations for hospitals or hospital facilities. I would direct that question to the Pandemic Task Force, but I'll try and answer it based on my conversations with them. At this point in time, there hasn't been any indication that they plan to set up 10 hospitals or hotels and turn them into hospitals. They believe they have enough space within their facilities to handle patients. What they don't have are doctors and nurses and respiratory therapists and other people to take care of those patients. They just don't have enough people. And as more sick people come to the hospital, as our healthcare workers get sick from COVID or are quarantined because they've been exposed to COVID, then that's going to be even more of a difficult formula to get enough trained healthcare workers in the hospitals to take care of the patients.
Did we ever use that facility at all?
Yeah. The question is, did we use the hotel in North County? We did not have the wave that we expected back then, but we did use that facility for people that were discharged from the hospital that didn't need ICU care, but still needed close nursing supervision. We were lucky that the decisions we made early on in the pandemic limited the impact in our community, and we were not overrun as much as we expected, but we still did use some of those facilities.
For those people who are in quarantine, has there been any discussions about maybe supplementing their income, maybe CARES Act funds or anything like that?
The question is about supplemental payment or supplemental funds going to people who are quarantined or otherwise impacted by the pandemic. At this point, St. Louis County is not considering any sort of direct payment to people that are impacted by COVID. As we saw early on in the process, there were some direct payments by the federal government, but direct payments to individuals in our community would be a little bit outside of the scope of local government. We'll be focused on the public health response and getting the public health resources out in the community and the humanitarian relief, making sure people have something to eat, keeping them warm this winter. That'll be our focus in the coming weeks. Okay, thank you.